And you presumably can hear me. Not that I need, not that I need anything, and my wife, who is monitoring this remotely, says that she can actually, and she can see me, okay. Okay, well, very good. The topic of today, well, the morning topic is on brains, and that's what I'll talk about for 15 minutes, but the overall topic of performance is something that in sort of another part of my academic life is something I've been interested in many over the many years of my time in universities, first at Cornell and then at the University of Texas now. That has been an ongoing thing, mostly connected to the intercollegiate programs in both places. You can imagine the Texas program is a little bit bigger than Cornell, and but also the whole concept of what you put in your body is actually relevant for performance, and you like not to step too far over the line. Doping control is something I've been deeply interested in over the years too. If anybody's interested in things like Tour de France, we can talk about that afterwards. But today I'm going to tell you a little bit about, in a way, what I did on my summer vacation. You know, it's a little bit the kindergarten talk, maybe first grade, you may have seen something called Operation Storksky, which was announced by the HHS secretary and the FDA commissioner. And Operation Storksky was something that I ended up getting involved with very right at the beginning. And the reason I chose 8-tracks, and that actually is an 8-track player that still exists in my garage, with a Beatles 8-track and a Ching Ching Chong on top. And back when they were young. And the reason I thought about that was that the Infant Formula Act was signed in 1980 by Jimmy Carter, and it was, well, Washington being Washington, it took until 85 before regulations were ready and were then enacted. And it has really been pretty much since then that we have the regulations around infant formula, and they really have hardly been updated since then. My AI of choice, well, at least when I gave one of the title was Claude. If you haven't noticed Claude yet, and you're a Chat GPT person, well, Claude is really very literate. It writes nice poems and titles and things like that. Now they kind of all do now, but I rather like that. And Claude is named for Claude Shannon, and for the hyper nerds in the room will know who that is, father of informatics and things like that. So that's our 2025 symbol. So, and just to emphasize this point about the story of our updating of things, so it was 85 that we had enactment of the regulations around infant formulas. There was an assessment in the mid-90s that was published in 1998, and they quoting from that document, clinical and basic science studies on the effects of supplementing infant formula with arachidonic acid and omega-3 DHA, which is the fish connection, the seafood connection, are being pursued. The expert panel recommended that the question of requiring the addition of specific long-chain polyunsaturates to infant formulas be reassessed within 5 years. Okay, so that was 1998, and 1998 plus 5 is 2003, and we're in 2025, and so with at the moment we're not sure when the end might be, but at any rate, that was the message that we were faced with in June when we started talking about this. I'd like to point out that in the period 2001 to 2003, those studies were published. It's not like they weren't published; they were published, and so I just picked a couple that were in my archives. 10 studies on term infants, those born at 40 weeks. 11 studies on preterm infants, those born earlier than 40 weeks, earlier than 37 weeks, actually, and then more studies published in 2003. And so there actually was actionable stuff that happened in 2001. And actually in 2001 and then into 2002, we had the FDA agreeing to enable or allow DHA and arachidonic acid into infant formula. That happened, December 2001, and then 2002 began to become available. And still it was only allowed, though moms were paying something like 20% premium for that, and pretty much it went to close to 100% of all infant formulas in the US within a few years. So brain health, and this was all on the basis of brain health for the kids and faster neurological development, and I'll show you a little bit about that. So a nice question would be, where do we sit compared to other regulations in the world? And I pulled this from a paper from 2021. The first author is Susan Carlson, who's in the room. And here is a plot that shows, let me see if I can point. Second. So pointer. Laser pointer. Laser pointer. Yes. Okay. So 2021, and here are various regulatory agencies. There's Codex, which is a European thing. There's European Food Safety Authority, which is here. That's China. That's Australia and New Zealand. There's the FDA. There's Russia, and there's a human milk reference level. And this is for our essential fatty acid, linoleic acid, and so we have requirements for the shorter chain plant-based ones, which have been in formula forever. But then if one looks at arachidonic acid, I really want to point out the FDA number. So the FDA number is the minimum for linoleic acid, and there's no maximum. And you notice everybody else has a maximum for linoleic acid, but not us. And if you go to alpha linolenic, that's the omega-3, you see numbers here, but the FDA doesn't have one. We don't have one for omega-3. None, zero. That makes a difference. I'm going to show you in a moment. And then if we look at what's happened more recently, here's arachidonic acid. We have some requirements in China that they're making a requirement for arachidonic acid. And then you'll see the Europeans are making it for DHA. This is our omega-3 DHA. We've got requirements for that. And so you can see my boxes for the FDA are sadly no different than they were in 1985. So we need to do something. This is my real what I did on my summer vacation. So some way I guess when they went around the room and said, "Who are you? Introduce yourself." And I looked into the camera and I said, "Well, I think I'm the fat guy." And they thought that was funny, sort of funny. And so I got tapped for a number of things like an interview. If you want to talk to people in Texas, Fox News is a good place to compare on. And but I got NPR and New York Times, and this is not the limit of it. So this was a bit of things that I was doing. But going back to sort of ask the question, why is this all important? And this was something that I showed. This was a 1984 rapid communication, a rapid publication, and this was a study done by one of our heroes in omega-3s, Bill Connor and Martha Nerger, and you'll see it very well there. But this is their study, and they fed pregnant rhesus monkeys as the sole source of fat. Safflower oil, which is deficient in omega-3, and soy oil, which is not deficient in omega-3. And then they looked at their visual acuity. This is a very sensitive measure as it develops in infants. So they looked at the visual acuity, and they found that the visual acuity in the animals that had omega-3 deficiency was actually quite poor as it developed. The ones that had some omega-3 was much better. And we've got evidence, which I'll show you in a minute, that shows that that even more omega-3 is better. So this was 1984, okay? So we're still a little bit behind the curve here. We had evidence then that supported these things. These are studies that I like that came from the Retina Foundation of the Southwest and were done in the 1990s. And what these show, so is this a DHA thing? Could it be a DHA thing in human infants? And what this shows is, again, visual acuity, and the scale goes opposite on the last slide, but it's still the Snellen scale in 2020 is average vision. It's actually not perfect vision, it's average vision. And what this shows is that the duration that kids get DHA, we'll just say DHA, the duration in the first year of life actually corresponds to the visual acuity measured at 1 year of life. So the more DHA they have, whether it's from formula, and I hate to say it, but even from breast milk, and there's a breast milk number there, well, that should be a little bit better with the breast milk, but even so, that's what the line looks like, okay? So DHA through this period is related to visual acuity at 1 year of age. So that was another important piece of data. And now I'll move pretty quickly because 15 minutes goes fast. I'm okay. She's supposed to take my time. You don't want to tell me that. Okay. Okay. So that's visual acuity. So what do we have anything more about neurocognitive? And the answer is yes. And there's a couple of papers that I'd like to point to. This was a study that was published in 2022 of neonatal DHA, omega-3 DHA in preterm infants. That they gave kids DHA, I think it was about 60 milligrams a day. During the period, these kids were born, let's say, at about 27 weeks of gestation, out of 40 weeks total. And during that period, they were giving them daily a dose of DHA. And they were measuring other things than neurocognitive in the study. But they went back and they found the kids at 5 years old, and they asked what is their IQ at 5 years of age. And what they found was that the kids that got DHA had 3.5 point IQ points higher at age 5, school age, and that's with no intervention after they left the hospital. Nothing. They just went away. And that's what they got. This is actually really very significant because these kids have deficits in IQ on average, and this made up a big fraction of the deficit, whereas 100 is kind of the average for the population. So if you have around the 92 and now you come up to 95, that's going to make a big difference in kids. So that was a big one. And then I like to point out one of our studies, which took place in Africa. These were in severe acute malnutrition, so this is a little bit different. But again, preterm birth is a kind of a challenge, a metabolic challenge, and severe malnutrition is a challenge. And for these kids who have severe malnutrition, who are between ages 1 and 2, roughly, these are kids that are really in trouble, and they are rehabilitated by being provided with ready-to-use therapeutic foods. And these foods are sort of a packet and with peanut butter, non-fat dried milk, vitamins, minerals, and lots of oil, lots of sugar. So they eat it, they love it. But the fatty acid profiles were really pretty bad, actually, originally. Very high amounts of the omega-6 side that was competing out the omega-3 side. And when we reformulated it, and this is a busy plot, but I'll just say that the kids were fed this for between 4 to 12 weeks until they recovered. And so then we sent them home. And then we brought them back 6 weeks later. No intervention during that period. 6 weeks later. 6 months later. I say weeks now. 6 months later, we brought them back and tested their neurocognitive function. And this is the key one right here. The DHA kids that had some modified omega-6 perform better than the kids on the standard ready-to-use therapeutic food. So those last two slides are both about long-term improvements. Okay, so there's some seafood. Why is seafood good? Well, I just telling you all about DHA, right? So DHA is great and lovely and fantastic, but we are actually not just one-trick ponies when it comes to seafood. Seafood is loaded with what have been called brain selective nutrients. So you know about DHA, but the minerals are a big deal. Iron, iodine, zinc, copper, selenium, and there's people in the room who are adding to that list in their heads. Those are just some of them. And you know, the wonderful thing about seafood is that there's so many different kinds of seafood. Right, so I'm from Texas. I like barbecue too. So there's beef, and beef is beef. It's one thing. It's beef. But seafood is like everything, and lots of things. Not everything. It's lots of things, and people can explore that and never get bored. I'm almost done. So what's next on Operation Stork Speed? Well, we just finished the comment period. So if you wanted to make a comment, too late. But September 11th was the end of the comment period. And so we're expecting to hear again to see what we're going to do next on Operation Stork Speed. And that's about as much as I can tell you about what's next. And so here I'm at the end. Overhauling the regulations for infant formulas really is long overdue, folks. That's pretty clear. Seafood omega-3 is a big part of what ought to be the formula, but isn't. And that's a thing that is going to transmit to making moms as healthy as possible, and for breastfed kids and as well. And one has to always say that breastfeeding remains the most reliable feeding for babies. We know that. Lessons learned in making formula as great as possible. Notice I didn't use the phrase of the year, make formula great again, because breast milk is great, but we want to make formula as great as possible. But it implicates our seafood as a nutrition machine for moms. And so that's my story.
We have a couple minutes for questions, and for those online, please use the Q&A feature. So happy to take any questions you have for Dr. Tom Brenna.
You said there was a feeding relationship, omega-3s and omega-6s. Can you tell a little bit about that?
Sure. I have to be a little technical here. The metabolism of these two families of fatty acids is handled by the same enzymes. But that's been known since I don't know, 1963. And so more omega-6 versus more omega-3, and this is like an ongoing debate that's been going on for 70 years. But the underlying biochemistry is very well established that they don't have separate enzymes. They have common enzymes, and that happens for the fatty acid stage. It happens for when they're converted into signaling molecules, which are pretty important too. It also happens for everything. Every step, pretty much. I can think of one or two where it doesn't, but they compete.
Most of the supplements have both. A lot of
A lot of them do. The original fish oils and marine oils will just mostly have omega-3. But other folks will put in more fatty acids. So
For this online, the question was, do omega-3s and omega-6 compete with each other?
Sorry, I should have said that.
Okay. Any other questions from the audience here or online?